Hi, my name is Dr. Aston Goldsworthy, and today I'm going to talk to you about why you still might be having pain even though you've had a total knee replacement. So before we really get into the treatments for this, let's kind of talk about kind of the order of operations or things that should have happened prior to your knee replacement to give you the most success. So typically before you have a total knee replacement, you should be doing some sort of physical therapy to increase the strength and flexibility in that knee, so that way the surgery goes well and the recovery is faster. Post-surgery, you're going to have physical therapy as well to continue to increase mobility and strengthen that joint. As we know, in a disease process, you have the beginning of one and then you have the end of that disease process. And so at the beginning, usually there's a functional issue that has occurred. Something, in the knee, for example, it may be an over-tightened piriformis, which is a glute muscle that externally rotates the leg, causing a change in your gait, which has now put pressure on the inside of your knee, which over time causes it to break down because it's a weight-bearing joint. You add being overweight to that scenario, it's going to accelerate that process. So function is lost and then symptoms begin. So basically halfway through the process you start to develop symptoms. So by the time you develop symptoms, you've gone quite a ways into damaging this joint. And then eventually you get to the end, which is the total knee replacement. But in some cases it's not the end, it goes further, because as we all know, that surgical repair doesn't necessarily guarantee success or pain-free. Patients that get total knee replacements sometimes report worse pain, the same pain, or no change in pain, and sometimes an improvement in pain for a period of time. So we're going to talk about the patients that didn't have an improvement, that are still having the pain. And so what we have to look at now is, alright, so the osteoarthritis has been corrected because we've replaced aspects of the knee. So what else could be causing this? It's no longer a friction issue. Is there something else going on? And it makes us want to look into things like nerves. So one of the main nerves that is involved with the knee is going to be the geniculate nerve. And the geniculate nerve can be damaged in any area that it runs. And so that damage can occur basically due to a trauma prior to the surgery. It could be due to the malpositioning of the knee that actually caused friction and actually damaged the nerve. And it can also be damaged in the surgical repair. So when you damage a nerve, typically what you're going to see is that the covering around that nerve, called the myelin, this is where the nerve runs out, gets damaged. And that covering is similar to like the rubber over an extension cord. It allows this electrical signal to be conducted. So if you have damage to that myelin sheath, that nerve signal isn't going to transmit the way it's designed to. It's going to actually kind of dissipate out and cause symptoms. Those symptoms can be sharp pain, burning pain, achy pain, pain with movement, you name it, any type of pain you could typically have with damage to the myelin sheath. And so currently how this is treated is by the same mechanism back here where we did a symptom-based treatment, which eventually led to a surgical repair. So as we know, symptom-based care is going to lead to surgical repair. So you want to do function-based care. So what's the functional issue here? Well, there's several functional issues that led to this, but the functional issue here is that there's damage to the myelin sheath, and so the nerve isn't moving correctly. So taking things like gabapentin to block that sensation, or doing injections like nerve blocks, or doing radio frequency ambulations basically to sever the nerve, those are actually not going to treat the root cause. They're just going to mask the symptoms, and typically it's going to return. So the only way to really treat this in a way that is at the root cause is to actually try to heal that myelin sheath. So one of the issues why the myelin sheath doesn't heal on its own in the first place is because often there's a lack of blood supply to that nerve. And so when you have a lack of blood supply to the nerve, you can't get essential nutrients that nerve needs to regenerate to that nerve. And so what we utilize to get those nutrients into that nerve so that nerve can then start to regenerate is a device called the RST Synaxis. The RST Synaxis is an FDA cleared device for chronic pain. And what it does is it uses electrical frequency to drive essential nutrients into those nerves. The nutrients is introduced by subcutaneous injections around the knee, and then since those substances have positive and negative charges, they will actually be driven into the nerve. And we know electricity follows the path of least resistance, and the least resistance is always going to be a nerve. And so when you can drive those nutrients into the nerve, and you drive enough of it in there, eventually you'll start to see myelin repair or myelin regeneration. And if you can get a full regeneration of that myelin sheath, their symptoms will go away completely. Typically what we're seeing, depending on the severity of damage, because obviously the more damage that's done, the harder it is to fix. The longer you've had it, the harder it is to fix. The nerve's dead, can't be fixed. But what we see in our office is usually a 30 to 80% reduction in symptoms, which is usually life-changing for that patient, because imagine 30% of your time having less pain and 30% less pain. That's a pretty big deal. If you are lucky enough to be in the 80 to 100%, well, you know that's a huge deal. So if you've had a total knee replacement and you're still having pain and you're kind of giving up hope on things, there are other options out there. These are insurance covered services typically, depending on your carrier, and so you can get treatment for it, and you can start to address this and maybe get back to a normal functioning life. So I hope this was helpful and informative. Once again, check us out at coremedcenter.com. My name is Dr. Aston Goldsworthy. Thank you for watching.